Here's Andrew Sharp from Health Watch West Berkshire.
If you remember, we spoke, I think, last July about the poor vet's assistant who was waiting for nearly a year in constant pain. And we haven't really moved on much from there. The pandemic has laid waste to the dental industry in terms of its ability to manage lots of patients, partly because it was told to. You know, they were at the back of the queue for PPE and stuff like this. They obviously had to spread their appointments far greater. So the dentists are actually trying the best they can within the parameters. But, you know, it's really interesting. On the day we're talking about waiting lists, and the extra £160 million that's going into trying to do things about hips, knees and shoulders, what does it say in the press release about dental waiting lists for NHS services? I'm guessing nothing.
I've not seen anything reported about it, so you're probably right.
It's the utter Cinderella service. There were 18-month waiting lists for community dental before the pandemic. People are constantly being told 3 months, a month, whatever, but if you pay, you can have it tomorrow.
Yeah, see you tomorrow. And is there any point, Andrew, for people who are listening who are thinking they're not happy with the service they're getting, whoever's sort of fault it is, that doesn't in the end really matter for the patient. Is it worth shopping around and changing dentists now, or is that going to put you in an even worse situation?
No, it absolutely is. We have got a COVID report coming out next week where we have recommended they restart NHS dental from scratch, root and branch, the whole thing. Because the public believes NHS dentists run like GPs. You register with your NHS dentist. That's fundamentally wrong. I've been told by the NHS, it's a bit like hairdressers. You go where you can get an appointment.
Yeah.
So the whole of the public basically believes, a bit like with GPs, well, I have to register with them. They're my dentist.
I have my dentist. I've always been to that dentist.
And for NHS patients, that's fundamentally wrong. But the other thing I just wanted to mention is really important. 25% of the population basically don't go to a dentist. And this is before the pandemic. So we have this huge problem of health. It doesn't rest with our clinical commissioning groups. So if you ask them about oral health, they go, it's not us. And so it's one area of health where, you know, we know mental health has been stigmatized, but dental, it hasn't even got a campaign to say, you know, can we get 100% of the population seen by a dentist? It's an absolute national disgrace.
That was Andrew Sharp from Health Watch West Berkshire.